Thank you for joining us today. This panel on COVID and COVID-19 and Africa's vaccine access is hosted by the Department of History, Political Science and Philosophy and the Africana Studies program at Delaware State University. I'll be moderating today. I'm Donna Patterson. I'm the chair of the Department of History, Political Science and Philosophy at Delaware State University, and my research interest in my work is primarily in global health, history of medicine, and African studies. Our first panelist today will be Dr. Stephen Karingi. Dr. Karingi is an economist. He is the director of the Regional Integration and Trade Division at the United Nations Economic Commission for Africa. He has worked in Addis Ababa at UNECA for a decade. Prior to joining UNECA, he worked as a senior analyst at the Kenya Institute for Public Policy and Research, KIPRA. He writes on trade, financial flows, and economics in African and European markets. Our second panelist will be Dr. Fred Aboka. He's a political scientist, and he is a senior researcher at the French Research Institute for Sustainable Development. He has worked on health and HIV/AIDS in Africa for almost 25 years. In addition, Dr. Aboka has been a lecturer at the Paris School of International Affairs at Sciences Po in Paris, at the Sorbonne, and at the University of Cheikh Anta Diop in Dakar. He is the author of about 100 articles in several journals, and he has published several books. His most recent publications include Public Policy Lessons from the AIDS Response in Africa, and a special edition on global health for Politique Africaine. Our final panelist will be Dr. Daniel Guiber-Michael Bersha. He holds a medical degree and a master's degree in public health. He works as a technical advisor to the minister in Ethiopia's Ministry of Health. He is a leading medical expert and has more than 17 years of experience. In addition to his current post, he has served as the Director General of the Ethiopian National Bank Service. He's worked in as the Medical Service Director at the Ministry of Health and as the Chief of Staff for the Minister at the Ministry of Health. Also today, Dr. Edward Dawley, an Associate Professor of French in Delaware State University's Department of Languages and Literatures, joins the panel as a translator for Dr. Aboka. Welcome, and we will jump right in with Dr. Stephen Karingi and move on in the order of the panelists.
Thank you very much, Donna. Let me share my screen. I'll make it large. So, good morning, and good afternoon, and good evening for those of us in the evening now. I hope you hear me clearly. Moderator, Dr. Donna, how many minutes do we have? Is it 10 minutes?
It is 10 minutes, 8 to 10 minutes, yes. And I will be keeping.
Okay, so I'll go quickly. Okay, so thank you so much. So let me begin. Yeah, thank you. So I'll begin basically by talking about what COVID has done in terms of impacting our African economies. And then I'll talk about what the vaccine means for the continent and what the delay in access to these vaccines mean to our continent. Then I will talk about one of the biggest agenda that we have in the continent over the last couple of years, and which promises huge potential for the continent to recover from the COVID-19, and tell you a little bit about it on what we call the AFCFTA anchored Pharma Initiative. Now, in terms of the economic impact, just like most regions, what had been forecast would be the outcome of 2020 before COVID. What COVID did is that it made it very difficult for Africa, like the other parts of the world, to be able to attain the projections that had been made earlier. So based on the estimate of the work that we have done here at the Economic Commission for Africa, it is estimated that our growth in 2020 actually, initially it was thought Africa could actually get up to 3.2% of growth, but the projections are that the economy contracted by almost 3%. the worst case scenario that we had. Now, so what were the channels that caused this? I know all of us have been listening to this, what has been happening. Most of the news talk about the drop in production because of the lockdowns that were experienced even here in the continent. Also, we know that because of the lockdowns, most households could not actually demand goods and services, and that also an impact in terms of the flow of goods and services, both within countries and between African countries and between Africa and the rest of the world. So the trade channel was very critical, and especially also within the continent and in African countries, especially in the area of services. Now, just to give you an example, if you look at the most of what is happening now in the context of COVID, one of the critical things that comes to your mind is the issue of the health sector in the continent. Now, the sad thing is that Africa imports up to 94% of its pharma requirements. So if you were to think for a minute what Africa was going to do to deal with the COVID implications, especially when the lockdowns were also accompanied with export restrictions of pharma, PPEs, because if you remember, there was a time at the beginning of the year when countries did not want actually things to be exported that were essential to dealing with COVID. Or if you think about it now in the context of vaccines, that some countries have actually bought up to 5 times of what they need, and then Africa imports most of these pharma and medical supplies from the rest of the world. You can see how the dire situation in which the continent found itself, and something that has to change. So I just want to put those things in context. Who are the top 10 African importers of medicines? Also to show that we do actually have some exports of medicine and pharma products within the continent. And then the question is, how do we scale up the potential for the continent? And I'll come back to that. So now on this particular slide, I want to talk about the COVID-19 vaccines rollout, because this is what we are talking about. I've already said that a lot of the countries, especially mainly the developed countries, they have actually bought more than they need, and they have even paid. So as an African country, if you got these private pharmaceutical companies and say that you want some vaccines, you are sent at the end of the queue, and then you find that because contracts had been signed, there is that huge challenge of how do you access these vaccines. Now, for the continent, yes, herd immunity, that is 60% of the population. We need about 1.5 billion doses of this vaccine, and the cost of just doing that can be up to 16 billion. So it's a huge challenge for the continent, and as we shall see, in addition, these vaccines is going to have an impact on the ability of the continent to recover from the impacts of COVID-19. But having said that, let me talk a little bit about the opportunity, because as you know, we had a very difficult situation at the beginning of the year, but Africa was able to come together in terms of solidarity and what is called and establish something we call the African Medical Supplies Platform. I request that you check it as I continue, because that's a platform that was created by the Africans themselves, and through that, it was possible to aggregate the acquisition of what the continent needed to deal with the early impact of the early effects of the COVID-19. And we believe the supplies platform is also going to become very essential when it comes to the aggregation of the procurement of the vaccines. Now, so what happens if we do not get these vaccines quickly? I think it's clear you cannot reopen your economies. If you cannot reopen your economies, the challenge that we had of labor productivity, lockdowns is going to continue. Just to give you an example, we found that if you were to lock all the African countries, to lock the African economy at a go, you're actually going to lose up to 2.5% of annual GDP, which is about $66 billion per month, if you're just to lock the African economies at one. So those are the economic implications of our inability to get vaccines to the African people. Of course, there are public health implications because only 34% of the African population are able to access water and soap, things that are so critical to being able to fight the transmission and the spread of the virus. So it is important that besides the public health challenges that the continent faces, that vaccines, because they are going to deal with the inequality that currently that we face, because not everybody has access to soap or to clean water. Now, so what is the cost? Just because I'm talking to people in the university, just to let you know that if you look at the left panel of this slide, so if a vaccine dose is costing $1, then you need $2.67 in addition to that $1 because of the logistics that are associated with delivering this vaccine, this dose to the person who requires it. So I've already indicated that to get 60% of the African people are vaccinated to create herd immunity. We need $50 billion to be able to do that. But you can see there is a huge issue that we have to deal with here. Even if we were to get these doses, then being able to deliver them to the population is a challenge. So of course, the key thing here is the issue of securing financing, and I can say that of course the African governments under the African Union leadership, and the Economic Commission for Africa is part of this. They have created what we are calling the Vaccine Acquisition Task Force, because one would actually have to be strong politically to be able to negotiate, to be able first of all to lower the costs that the continent faces, and also to be able to get access so that those who have already signed contracts with these big companies, that they are also able to release some of these doses for the continent. So work is going on there, and I think the voice of academics would also be very, very helpful. So because I know you gave us 10 minutes, I will take it to each of these issues. You have the slides. You can look at them, and maybe we can come back to them during the presentation. Let me conclude by saying that from where I started, even though the continent imports 90% of its farmers, we have also been able to demonstrate that it is possible for Africa to scale up local production of its farmer needs. And so for that, including, like you know, South Africa is one of those stations where some of the vaccines would be produced. So we do have this African Continental Free Trade Area, which is removing trade barriers and regulatory barriers across the continent. The start of trading under this program has already taken place, and we believe it's a platform that the continent can actually be able to use to develop its pharmaceutical sector. And under this initiative, we are basically looking at how we can leverage on the AFCFTA to procure the vaccines, for instance, because smaller populations end up paying more money than big populations. Scale up the production because we have demonstrated that demand through food procurement, and lastly, be able to ensure that the standards are met, so that this issue of the regulatory framework that is required to enable the production, what we call the food manufacturing practices, is actually realized. So I hope been able, first of all, to demonstrate what has happened to the continent because of the COVID-19, demonstrated the challenge that we have in accessing the vaccines, what is needed to access the vaccines, but also the potential of the continent of being able to move forward with the ability to scale production from within the continent, having learned the lessons from COVID-19. So thank you very much, Donna.
Thank you. Thank you very much. And so our next panelist will be Dr. Fred Aboka, and he will be accompanied by Dr. Dolly, who will act as a translator.
Thank you very much. I'm very happy to be here. First of all, I would like to thank Dr. Jonah Patterson for inviting me to this important meeting. Thank you. As you may know, my slides are in English, but I will present my talk in French, translated by Dr. Edouard Dole. Thanks, Edouard. Okay, thank you. La perspective des vaccins contre le Covid en Afrique intervient à un moment tout à fait particulier.
Okay, the occurrence of the COVID virus in Africa comes about in a very special historic period.
Pour une fois, l'Afrique, vis-à-vis d'une pandémie, est un des continents les moins touchés de toute la planète.
Yes, for once, Africa is the continent that is least touched or affected by this pandemic.
C'est dans cette configuration que l'initiative COVAX a été lancée le 15 décembre 2020 pour l'ensemble des pays à ressources limitées.
And this is why the COVAX facility was set up on December 15, 2020, to allow for countries who have less resources to have access to these vaccines.
Dr. Stephen Kalunji a montré tout à l'heure les autres initiatives qui ont accompagné l'initiative COVAX.
Dr. Karinja talked about some of the other perspectives relating to access to these vaccines.
Mes remarques d'aujourd'hui portent sur le contexte politique et social dans lequel intervient la question des vaccins.
So my remarks will be related to the political and social context in which the vaccines will be initially distributed.
La question principale, un peu abrupte, à partir de laquelle je voudrais travailler, est la suivante. Est-ce que les vies africaines comptent?
Perhaps a rather provocative question that comes to mind, which will be my main question, is, do African lives matter?
Next, please. On a présenté le continent africain comme étant le moins touché, et la figure que vous voyez ici en est l'illustration.
Okay, we said that Africa was the least affected continent by the COVID-19, and this is a table that attests to that fact.
Il faut préciser néanmoins que l'Afrique présente une grande diversité de situations.
But we should point out that Africa has a great diversity of situations.
L'Afrique du Sud est le pays le plus touché de tout le continent par le Covid-19.
South Africa is the most affected country most affected by COVID-19.
Et les autres pays présentent des trajectoires différenciées, comme ce qu'on a vu aussi pour la pandémie du VIH-Sida.
And other countries have various scenarios, as we saw with previous outbreaks of disease.
Mm-hmm. Next, please. Alors, l'Afrique est épargnée par quoi?
What has saved Africa from the COVID-19 epidemic?
Le premier facteur qui a été présenté est la jeunesse de la population africaine.
The first major factor is the young age of the African population.
La figure que vous voyez là compare la pyramide des âges en Afrique puis en Europe.
The illustration that you see is the age pyramid for Africa on the left and the age period for Europe.
Et vous voyez que les populations jeunes sont massivement représentées et que les personnes âgées les plus sensibles et vulnérables au Covid-19 sont très peu nombreuses sur le continent africain.
You see that the young people are widely represented in Africa, but the elderly, who would be the major sufferers of the COVID-19, do not have a large demographic weight.
Next, please. J'ai voulu vous montrer cette photo qui illustre le second facteur de ce qui sauve en quelque sorte l'Afrique.
I want to show you this photo, which indicates one of the reasons why Africa has been more or less saved from the worst part of the COVID-19 pandemic.
L'Afrique ne connaît pas de mobilité massive dans les transports, les métros, etc., comme on peut voir aux États-Unis ou en Europe.
Okay, Africa doesn't have large-scale mass transit as that, like the mass transit we have in Europe or in the United States.
Les pays qui connaissent la plus forte progression du Covid en Afrique sont aussi les plus industrialisés au nord et au sud du continent.
The countries that suffer most from the COVID are the industrialized countries in the south and the northwest of Africa.
Next, please. Comme l'a dit tout à l'heure le docteur Stéphane Kalunji, les autorités africaines et l'Union africaine ont pris des mesures pour endiguer l'impact du Covid-19.
As Dr. Karinga just mentioned, various African institutions have had the political foresight to initiate measures to stop the propagation of COVID.
Ça a été tout à fait exceptionnel de voir les autorités africaines anticiper sur le Covid bien avant qu'il y ait un cas de Covid diagnostiqué sur leur sol.
This was rather unusual in that the African authorities took steps well before there was even a single case of COVID-19.
Next, please. Les autorités africaines se sont aussi adossées sur les épidémies précédentes en lien avec l'Organisation mondiale de la santé.
The African authorities also based their actions on previous experience with epidemics in conjunction with the WHO.
Next, please. Alors, est-ce que les vies africaines comptent réellement? À quoi faisons-nous face quand on parle de Covid-19 et de vaccins aujourd'hui?
Do African lives matter? What do we mean when we talk about COVID-19 in Africa in today's world?
Vous avez ici la couverture médicale en Afrique.
This here is medical coverage in Africa.
Vous avez le taux de médecins pour 1000 habitants sur la figure que vous voyez.
So you have here the coverage of patients per doctor in Africa, in the various regions.
La plupart des pays africains comptent moins de 1 médecin pour 1000 habitants.
Most countries in Africa have less than 1 doctor per 1,000 inhabitants.
Ce qui nous montre aussi l'enjeu de la vaccination contre le Covid en Afrique.
This shows the importance of having the vaccine in Africa.
Next, please. Nous assistons aujourd'hui à une seconde vague de la pandémie sur le continent africain.
We have a second wave currently of COVID-19 in Africa.
Mais cette seconde vague est directement liée aux efforts que les populations ont faits pour la première vague.
But the second wave is linked to the efforts made during the first wave of the COVID-19.
La photo que je vous montre,
the photo that you see here,
a été prise à Dakar sur la Corniche.
Was taken in Dakar on the Corniche.
Le lendemain du décret du couvre-feu.
The day after the curfew was declared.
Au moment où j'ai pris cette photo, les personnes pouvaient circuler librement sur cette corniche.
When I took this photo, people were allowed to walk freely in this park.
Et comme vous pouvez le constater, il n'y avait personne.
But as you see, there was no one.
L'Afrique a eu peur.
Africans were afraid.
Next, please. Alors, pour des raisons économiques et sociales, les mesures de restriction ont été assouplies.
For social and political reasons, the measures were relaxed somewhat.
Et on a assisté petit à petit à l'émergence d'une seconde vague, en tout cas d'une accélération de la pandémie sur le continent africain.
And after this relaxation of the measures, we saw an increase in the number of COVID cases.
Next, please. Et aujourd'hui, les économies africaines sont dans une situation tout à fait particulière du fait non pas de l'impact sanitaire, mais économique du Covid-19.
So African countries are in a rather strange position right now because there is the health crisis, but even more important is the economic crisis caused by COVID-19.
Et là, je me situe vraiment dans la logique de ce que a présenté le docteur Stéphane Karinga.
And this is piggybacking on what Dr. Stephan Karinga said.
Next, please. Aujourd'hui, on peut considérer que la pandémie du Covid-19 est aussi ce que nos collègues appellent une syndémie.
We could say that in Africa, COVID-19 is what we in the field call a syndemia. Mm-hmm.
Ouais. Une syndémie n'est pas seulement une pandémie.
A syndemia is not only a pandemic.
Elle met en scène une corrélation entre plusieurs types de vulnérabilité.
It emphasizes various types of vulnerabilities.
Et les maladies non transmissibles aujourd'hui sont mises à nu.
And non-communicable diseases are brought to the fore.
Elles représentent aujourd'hui les facteurs de comorbidité qui causent le plus de décès sur le continent africain.
And these non-communicable diseases add to the comorbidity of COVID-19.
Les vaccins ne doivent pas donc être une fin en soi, mais le début d'une ère nouvelle.
Okay, so the vaccinations should not be an end in and of themselves, but they should be the beginning of a new era.
Pour qu'on investisse massivement dans la santé publique en Afrique.
We should invest heavily in public health in Africa.
Dans les 25 ans qui viennent,
over the next 25 years,
les principales causes de mortalité seront liées aux maladies non transmissibles sur le continent africain.
A great majority of the diseases will be linked to non-communicable diseases in Africa.
Et c'est le moment, peut-être, d'avoir un plaidoyer pour un fonds pour la santé publique en Afrique aujourd'hui.
This would be the time to make an appeal for a fund for public health development in Africa.
Next, please. Pour finir, je voudrais reprendre une chanson très connue et avoir un petit message d'espoir.
So just to end, I would like to remind you of a very famous song that carries my message.
The change is gonna come. Thank you very much.
Thank you. Great. Okay, everyone. Thank you for these great presentations looking at different aspects of COVID-19 and vaccine access on the continent, but also raising a number of other issues, economic issues, social issues, public health issues. So I'll begin with a few broad questions, and then I'll open it up for the participants. And I have some other more specific questions as needed as we move into the presentation. So, as many of you have said, right now, as a continent, Africa has fared fairly well in terms of COVID response if we look at this globally. Of course, yes, we've seen more pockets of both deaths and also the numbers of people who contracted COVID, both died and contracted in parts of North Africa and South Africa, particularly in places like, excuse me, Egypt and Morocco and South Africa. But overall, as a continent, the numbers have looked fairly good. Do you think that the delay in vaccine distribution across the continent or many countries in the continent will cause a higher rise in the number of COVID-19 cases in the upcoming months, particularly as we're looking at a second wave across the continent? So that's my first question.
Is this addressed to
So, you can Eboko go first? I can take it. I can respond after.
Okay.
Vous avez compris?
Oui.
À peu près, mais si vous pouvez abréger la question, ce serait bien. Mais je pense avoir compris grosso modo. Mais vous pouvez.
Est-ce que vous pensez que le fait qu'on tarde avec les vaccins, est-ce que ça va provoquer une augmentation dans le nombre de cas de COVID en Afrique?
Merci beaucoup. Je pense que ce qu'on appelle le retard vis-à-vis de la distribution des vaccins est paradoxalement une opportunité.
I think paradoxically that this delay in distributing the vaccines could be an opportunity.
Les États africains vont avoir le temps et le recul vis-à-vis de toutes les incertitudes qu'on a aujourd'hui par rapport aux vaccins.
The African authorities will have time, and also they could have more time to think about how to proceed in dealing with the COVID.
Pour finir, l'urgence aujourd'hui est d'améliorer la prise en charge des patients qui sont aux urgences dans les différents hôpitaux africains.
The major challenge right now is to be able to treat the patients who are in the emergency room today.
This is my answer. Yes.
Okay.
That was my answer.
Okay. So thanks. Now let me take the same question. Every Wednesday, we have a platform here that put together the Economic Commission for Africa, where we have all the main actors that thinking how to address the challenges of COVID. And we normally start that meeting by listening to the World Health Organization. So they present the statistics of what is happening globally. Then we zero in on Africa, and sometimes we drill down to what we are seeing in a number of African countries. Now, so since the beginning of this year, we have had two sessions. We had and what we have seen, and I'm trying to answer this question. So what we have seen is that in some countries, let me take some of the countries in Southern Africa, a country like Malawi, the deaths have actually risen by a huge proportion, a huge percentage. And when you ask the question of why is this the case, it's basically because the supply, for instance, of oxygen and the equipment that you need for oxygen to treat the people who end up to the hospital is not there. And so we have seen an increase. In fact, I had a statistic that it took 146 days to reach 20,000 deaths in the first wave. And it took 26 days to move from 60,000 deaths to 80,000 deaths. So if you look at the rate of change, you can see that there has actually been an increase in the fatality. In fact, the fatality rate for Africa now, the average is higher than the global fatality rate, 2.6% against a global rate of 2.2%. So then you have the new variants. Now, when you listen to the experience of the community and also to the professionals, it looks like some of these new variants at least in Southern Africa, from what I have heard, is that people are becoming critical faster. So based on the evidence, I would want to say that we are going to see an increase in the number of deaths if we do not have a way to attain herd immunity or stop the transmission of the virus. Having said, I want to agree with Dr. Eboko that it's also a time for Africa to put in place mechanisms that can allow us to be stronger going forward and in future pandemics. But yeah, I do expect the fatalities to go up, and that's what I think.
Okay. Certainly, and I think, well, two things. I'm going to just change course a little bit. As I'm listening to both of you and thinking about this, so definitely with the delay in vaccine, you're going to see a rise in fatalities because you're already seeing this trend. And I personally have been concerned when I look both at the inequity in vaccine distribution and the difficulty in countries on the continent being able to get vaccines. For those who want to get vaccines, are getting very, very small numbers of vaccines. But also I want to go back to what you all said earlier about infrastructure. Both of you said this, Dr. Karingi and Dr. Boka, and I think this is a major issue because we saw, for instance, when there was the West Africa Ebola epidemic from 2014 to 2016, we saw that some countries had more, some of the health systems in some of the countries were more advanced than some of the other countries that had been impacted. But despite the kind of variance in those countries, there was this talk overall of really, kind of investing more in infrastructure both in those countries and other countries on the continent. And so now with COVID-19, we're coming back to some of these issues. So a lot of what you're saying to me, it appears, is kind of, public health support and infrastructure, and not only the vaccine, because then if you have these things such as oxygen and ventilators and other things, then that also will help in terms of the numbers. So what do you think in terms of the best ways to go about getting this? I know there's, the pharmaceutical calls and these sorts of things, and Dr. Boka talked about, an Africa Global Health Fund. What do you think about this? And I know there's been some early talk of financing. How do you think that this will actually come to fruition, I guess is my question. It's kind of a big question, but I'd like to hear your thoughts about that.
Vous avez compris la question?
Globalement, vous allez préciser encore, c'est toujours mieux comme ça on est plus sûr.
Oui. À votre avis, quel est le meilleur moyen d'entamer le processus de développer l'infrastructure de santé en Afrique? Où commencer?
Oui, alors la question des infrastructures est posée par la perspective des vaccins. On est d'accord.
Mm-hmm. So we agree that the setting up the infrastructure would be related to the current COVID crisis.
C'est le moment d'avoir une vision globale, à partir du Covid, mais d'avoir une vision globale sur les systèmes de santé en Afrique.
So we could use the COVID-19 as a stepping stone to a more global approach to improving African infrastructure, health infrastructure.
Les vaccins vont protéger les Africains contre une pathologie, le Covid.
Okay, the vaccines will protect Africans from one illness, COVID-19. Mm-hmm.
Et c'est très bien.
And that's very good.
Mais renforcer les systèmes de santé va faire en sorte que le patient Covid ou le patient qui souffre d'une autre pathologie, qui est en détresse respiratoire dans un hôpital, sera sauvé, qu'il ait le Covid ou qu'il ait une comorbidité qu'on connaît aujourd'hui.
So the goal would be that we could cure people who have COVID, or also people who have other diseases that are not related to COVID, or that may have an effective comorbidity with COVID. We want to cure all of these diseases.
Je pensais notamment aux respirateurs et à l'oxygène dont ont besoin les patients qui sont aujourd'hui dans les urgences des hôpitaux africains.
I was thinking more about ventilators and also oxygen, which helps people not only for COVID but other respiratory illnesses.
Voilà, merci.
Thank you.
Thank
Okay,
you. Go ahead. Thank you.
Okay, thank you, Donna. Now, on this question, so first of all, we agree that there is inequities, so to speak, in vaccine distribution that we are seeing globally. And I work for the United Nations. From the first day, global solidarity was emphasized by the United Nations. It's unfortunate that it doesn't look like that is happening. Even for the COVAX facility, if you talk, in this platform of ours, we do actually have the COVAX people come and talk to us. I think they spoke to us in our last session. And of course, we interrogate all this. So what Africa is likely to get from there can only cover about 20% of the population, the 270 billion doses that have actually been signed can only cover about 20% of the population. So there is this big question of solidarity, and I want to go back to that issue that Eboko raised about the politics and the socio of the vaccine question, and do African lives matter? I think it's a critical question in the context of multilateralism. But having said that, let me also say that when we think about delivering vaccines to the Africans, the first thing that you would hear is that we don't have the infrastructure. And I may even have said that myself, but that is not exactly what I did not mean that 100%, because Africa has actually been vaccinating its population using other vaccines. We have a huge livestock population, and we do actually vaccinate our livestock. Now, also, the backbone of COVID-19 in the continent. Take the case of Ethiopia, and this is an example that the Africa CDC director likes giving. The backbone of COVID-19 in Ethiopia is Addis Ababa. And it is possible to use Ethiopian Airlines to deliver even the vaccines that are supposed to be stored under -70 degrees centigrade. I don't know what is that in Fahrenheit. And it is possible to have fridges in Addis Ababa that can take care of -70 degrees centigrade. Now, if the backbone of this pandemic is Addis Ababa, and you can actually be able to do that, so it is possible for you to vaccinate the Addis Ababa population in just a few days if you have access to the doses. And that is going to make a big change to the pandemic within this country. So I think as we have this conversation about vaccines in Africa, we need also to say we can do things differently, because even if you try to map the population, the elderly people are just about 0.65% of the population. So you have to treat delivery and of the vaccines and the targeting in a different way. So I just wanted to respond to your question that way. I know you had talked about financing. We can come back to the question of financing because there is a huge political economy issue in the sense that, and I think also Eboko talked about this, but we've heard about the debt service suspension initiative, so that you can release money instead of repaying your debt. You release money and then use that money to be able to finance your fighting of the pandemic. Then I gave the figure of about $16 billion for you to be able to reach the population, 60% of the population of Africa to get herd immunity. Now, how do you raise this $16 billion when already the economies have contracted and you do not actually have a lot of opportunities for you to earn additional income because of what is happening to the global slowdown everywhere? And this is where now the international financial institutions and the multilateral debate of how do we finance the COVAX and everything that goes with that becomes critical, because as ECA, we've been saying we need to go back and look at the question of the special drawing rights within the IMF, which is basically giving an injection of foreign exchange, to the African countries, so that at least they can be able to finance acquisition of some of these vaccines. So there are a lot of those political economy questions, and you can only be able to deal with them if there is that willingness to engage multilaterally and with solidarity, global solidarity in mind. Sorry, I've taken too much in answering that. I'll not talk to the next question that you asked. Thank you.
Well, I was actually going to ask you one, but thank you. Are there any questions from the audience? I've put a comment in the chat, and I've asked you to enter your question if you have it. I don't see anything here, but I don't know if you've all reading the chat.
There's one question from Tavian Cooks. I've put in the chat. His question is, why does Africa import so many pharmaceuticals and medical equipment?
Vous avez compris la question?
From a student.
Oui. Pourquoi l'Afrique importe tant de produits pharmaceutiques?
La raison est assez simple. Elle tient de la faiblesse économique d'une partie des pays africains. Ça, c'est la première partie de la réponse.
Okay, the first part of my answer would be it's due to the weakness of certain African economies.
La deuxième partie de ma question est la suivante.
And the second part would be as follows.
L'Afrique du Sud est prête à fabriquer les vaccins contre le Covid. Le Maroc est prêt à le faire aussi.
Mm-hmm. South Africa and Morocco are ready to manufacture the vaccination.
Le Nigeria aussi récemment s'est prononcé autour de l'idée qu'il pouvait aussi fabriquer les médicaments.
And Nigeria has announced that it could possibly produce the vaccine also.
Ça montre les inégalités de situation économique et pharmaceutique sur le continent africain.
And that shows the inequality, economical and pharmaceutical inequality on the African continent.
Merci.
Thank you.
Thank you. Dr. Karingi, do you want to jump in quickly? I see there's another question, I think, too.
Yes.
Popped up. Okay.
This is from Zachary Kakomo. If the isolation and lack of infrastructure in part contributed to the shielding of damage to Africa from COVID-19 in relation to other continents and countries, would improving infrastructure to improve vaccine distribution also increase the spread of COVID-19? And I can repeat the question if you like.
Please.
Okay. Il a dit que l'isolement de l'Afrique a contribué un peu à la sauver des dégâts du COVID-19. Si on augmente l'infrastructure, est-ce que ça apporte aussi une possibilité d'une recrudescence du COVID-19?
Ok. En fait, la question confond deux aspects différents, les infrastructures sanitaires et les infrastructures de manière générale. Ce n'est pas la même chose.
Okay, we're not talking about the same thing. We have to make a distinction between general infrastructure and health infrastructure.
J'ai un exemple à donner.
I have an example to give you.
La Côte d'Ivoire, Ivory Coast, où je suis aujourd'hui, a moins de décès que le Sénégal, pour un nombre équivalent de personnes atteintes.
Okay, so more people die from COVID in Senegal than in Ivory Coast. I'm currently in the Ivory Coast, so I can attest to this.
Pour la simple raison qu'aujourd'hui, l'infrastructure médicale, notamment l'oxygène, ne manque pas à Abidjan, mais fait défaut un peu plus à Dakar au Sénégal.
It's because Abidjan, the capital of Ivory Coast, has oxygen, but in Senegal, oxygen is not as plentiful.
And Dr. Boca, just to draw down a bit on those numbers in terms of the number of people who are dying in Côte d'Ivoire and Senegal, what do those look like? Because compared to the West, for instance, those numbers are still significantly lower, aren't they?
Est-ce que vous pouvez nous donner des chiffres? Parce qu'il me paraît que les nombres sont moindres en Afrique par rapport à ce qui se passe aux États-Unis, par exemple.
Les décès sont moindres de manière générale du fait que la population en général est plus jeune.
Okay, they have fewer deaths in Ivory Coast because the population is younger.
Maintenant, quand on compare les pays africains entre eux, on a des situations qui sont extrêmement intéressantes.
Okay, but when we compare African countries among themselves, we see a very interesting situation.
Un exemple.
I'd like to give you an example.
Abidjan, la capitale économique de la Côte d'Ivoire, a été fermée lors de la première vague. On a fermé Abidjan, qui concentrait le plus de cas. Et aujourd'hui, l'épidémie s'est très peu disséminée dans le reste du pays.
Okay, Abidjan, which is the economic capital of Ivory Coast, had a shutdown at the very beginning of the crisis. And so the COVID-19 was not able to propagate massively.
Donc, dans la deuxième vague, on sent plutôt une montée de la pandémie en Côte d'Ivoire, mais pas encore une deuxième vague qui existe déjà au Sénégal et qui existe au Cameroun. C'est un concours de circonstances et aussi une décision politique qui différencie des pays africains.
Okay, thank you. Are there any other questions in the chat?
Okay. No, before I was going to add a point on why does Africa manufacture, import so much?
Okay.
Also to say that there is an intellectual property rights dimension to some of these things. So obviously, when it comes to issues of pharmaceuticals, you need to invest a lot on R&D. And if you're not able to invest enough on R&D, at least if other scientists discover the ingredients that go to this, what we call the active pharmaceutical ingredients, you also need to be able to use those formulas to produce. So there is that dimension that because of the competing priorities that the continent has, it is not able to invest enough in R&D. That is one thing. And then also it comes now to be able to use the formulas that have been discovered. Then you find yourself it's so costly even to be able to pay for these intellectual property rights to be able to produce that. And even if you have your own, it's so costly sometimes for an African scientist to register some of these intellectual property out of their R&D. So there are a lot of things that explain as to why there is this huge importation. But like I said, under the African Medical Supplies Platform, it has been possible for the African pharma manufacturers and African manufacturers in general to ramp up their production and repurpose their production lines towards supplies that could address COVID. So also the economies of scale do matter, and that's why I say the African Continental Free Trade Area is going to make it possible for value chains to emerge that will link to South Africa, to Morocco, and we are going to see probably more and more production of pharma products within the continent.
And that's very important. Thank you. Nick, do you see any other questions there?
I don't.
Okay, well, we're near the end anyway. So if no takers, panelists, do you want to add a quick closing thought as we close the panel?
Oui, je voudrais juste dire un mot sur le changement majeur que représente le Covid aujourd'hui. Oui.
I would just like to talk about the major change that COVID represents for us today.
C'est une autre image de l'Afrique qui est en train de se dessiner.
We see another image of Africa emerging.
Et ça montre aussi la capacité des États africains, même avec de faibles moyens, avec le leadership politique, de faire avancer les choses sur le continent africain.
It also shows that African leaders can make political decisions that will make Africa advance.
Merci.
Thank you.
Thank you. Dr. Karengi?
No, thank you. I think after what Boko has said, because I think it has been demonstrated. So what COVID-19 has done, in addition to what it has demonstrated in terms of political leadership, I think it has also taught Africa that things that would have taken us 7 years to do, we were able to do them within a few months. That even though we were not able to cover the whole population, we had digital delivery of a lot of things. We have seen digitalization beyond financial technology accelerate in many sectors. So there is a positive acceleration thing from COVID-19. But having said that, we are not going to benefit from that if we lose our lives. So we still need to get the vaccines to the populations so that at least we can be able to leverage all this new innovation and all this acceleration that we have seen in terms of adaptation and agility of businesses and individuals. Thank you.
Absolutely. Thank you. That's a good way to end. Okay. Thank you, everyone, for joining us today. We appreciate your attendance, and I'd like to thank our panelists for these great observations, and I hope you learned something from today's discussion. Thank you.